Hello, dear friends. Today, let's talk about tinnitus. This phenomenon is scientifically called tinnitus from the Latin word tinere, which means to ring. If you believe statistics, about 20% of the adult population and 13% of children suffer from this phenomenon. From a practical point of view, tinnitus is divided into two broad categories, subjective and objective. In subjective tinnitus, the sound or noise is not heard by anyone but the patient. In objective tinnitus, the sound can be recognized by others around the patient or a doctor, such as listening with a stethoscope. Understanding the structure of the human sound analyzer will help to understand why the sensation of noise, both subjective and objective, should occur. The sound analyzer consists of the sound receptive system, the sound conducting system, and the system that analyzes sound to put them together into something meaningful to us. The sound receptive system is the auricle, the external auditory canal, the eardrum, the structures of the middle ear, namely the malleus, incus, and stapes, and the inner ear, where the cochlea is located. The auricle has fluid that vibrates according to the intensity of mechanical vibrations. The mechanical waves are transmitted to the hair cells, which are located in the cochlea. The hair cells produce electrical impulses, which then travel to the cerebral cortex as part of the eighth pair of cranial nerves, and in the cortex, the noise is recognized and given meaning. Any disturbance of one of these three structures of the sound analyzer can cause tinnitus. For example, wax in the external ear canal, pressure on the eardrum, excessive exposure to sound such as explosions and gunfire, impaired mobility of the malleus, incus, and stapes, disturbances in the tone of the muscles that regulate the movement of the malleus, incus, and stapes, inner ear disorders, damage to the auditory nerve. All of these can cause the phenomenon of subjective tinnitus. However, the most significant cause of subjective tinnitus is the abnormal electrical activity of cortical cells. In the cerebral temporal lobe, at both sides of the cerebrum, is a zone called the auditory cortex. This cortex has cells called neurons. They can sometimes exhibit independent electrical activity, in other words, generate impulses without any stimuli that originate from the sound conducting system. Such impulses are called phantom impulses. For the brain, it makes no difference whether a phenomenon is actually happening or just a stimulation of specific cortical areas. For example, when we sleep, we clearly see some dreams and experience everything as if it were happening in reality. During amputation, a person can feel the amputated limb for a long time. It seems to him that it hurts or itches. Such sensations are called phantom sensations. Similarly, phantom sounds may also occur, which do not depend on anything but are associated with abnormal activity of the auditory cortex. Nowadays, this theory of abnormal activity of the auditory cortex is the dominant explanation of the subjective tinnitus phenomenon. The second kind of tinnitus is objective tinnitus. It's caused by a disease of structures not related to the auditory analyzer but located near it. For example, tumors near the auditory nerve and having intensive vascularity or intensive vasculature. In this case, a person can hear the pulsation of vessels, and consequently, the noise in his head will be pulsating and unilateral. By a similar mechanism, tinnitus develops when the internal carotid artery is affected by atherosclerosis. The internal carotid passes through the temporal bone. If atherosclerotic plaques are located in the internal carotid or somewhere further away, for example in the common carotid or bifurcation of the carotid veins, the sound that occurs during turbulent movement of blood very well passes through the bony structures. Accordingly, the person also begins to hear a pulsating noise. Another pathology that can lead to objective tinnitus is arteriovenous malformations of the cerebral dura mater. These are abnormal connections between arteries and veins, fistulas when blood from the arteries immediately flows into the veins. It is accompanied by various disturbances in the structure of the vessels and also causes sound phenomena. When you know the anatomical and physiological prerequisites for the formation of noise in the head, it becomes clear what to pay attention to. The first thing to pay attention to is the nature of the noise. pulsating, or constant. The second is whether the noise is unilateral or bilateral. Third, it is necessary to determine whether the noise in the head is accompanied by any extraneous symptoms, such as dizziness, vomiting, hearing loss, or swelling in the ear area. Based on these three groups of symptoms, one can suspect how dangerous or not the condition is. What should a person who has experienced tinnitus do? Regardless of the nature of the noise and the circumstances that trigger it, one should see a doctor. At the doctor's office, one can undergo tests such as audiometry or tympanometry to monitor whether there is any damage to the hearing analyzer. If these damages are not present, if tinnitus is subjective, there is no pulsation, just tinnitus, which is most often the case, then it may be subjective tinnitus, which is caused by hyperactivity of the cells of the auditory zone of the cerebral cortex. The further diagnostic process becomes more complicated if other circumstances are revealed, for example, unilateral lesions, suspected tumors, or vascular disorders. In this case, angiography, duplex scanning of the neck vessels, magnetic resonance imaging, and other studies are used for diagnosis. You will ask, what is the treatment for the most common type of tinnitus? I'll be blunt. No credible treatment currently exists. Of course, you can read on the internet or watch videos on YouTube that advocate some particular tinnitus treatment methods, but it's all a bit parascientific. I don't rule out that such paramedical techniques help someone, but it's probably due to self-hypnosis and the placebo effect. If it helps, it's perfect. But in general, I want to say that there is really no way to cure tinnitus at this time, which is why these strategies are used. For example, tinnitus in the aged develops against the background of age-related hearing loss. In this case, it turns out that subjective noises are perceived more clearly as external noises a person cannot hear. What is done in this case? A hearing aid is applied, which brings the person back to the surrounding reality. He starts to focus on external sounds and ignores the internal sounds. Also, some people suffer from tinnitus in the evenings when external sounds disappear, and tinnitus prevents them from falling asleep. Such people are advised to turn on a fan, air conditioner, or any device with a weak permanent noise and drown out their internal noise. There are special appliances and devices that a person uses on the principle of a hearing aid. They generate noise, and this helps to suppress the objective tinnitus. There is also an essential factor. If a person has been examined by a doctor, excluding all diseases of the inner and middle ear, then, as a rule, the level of anxiety in a person is reduced. It makes the problem less acute. The fact is that any of our illnesses have two components, a physiological component, such as the perception of pain or discomfort, and a psychological factor. The physiologic component of pain in its purest form is a sudden physical impact. For example, if a person is bumped or burned suddenly, he was not expecting it, and suddenly it hurts. But then the pain goes away and he forgets about it. Now, imagine a situation where you're told that you are supposed to get an injection in a minute. You will shrink even before this event happens. This psychological component of pain or other unpleasant conditions makes the problem more acute. Sometimes, when the person is convinced that their tinnitus is not related to a tumor or other complex and incurable condition, they can calm down and learn to live with it. So, it is true that tinnitus treatment is more of a philosophical rather than a medical issue. However, in the case of tinnitus, which is associated with pathology, it is necessary to clarify the cause clearly. The reason, as a rule, is always successfully found out. If it is plaques, a stent should be placed. If it is malformations, remove the malformations. If it is a wax plug, the ear should be washed. Remember, if you experience tinnitus, always pay attention to the nature of the noise, whether it is pulsating or constant, whether it is unilateral or bilateral, and whether the tinnitus is accompanied by any side effects such as nausea, vomiting, or dizziness. Such characteristics of tinnitus will allow you to navigate quickly and decide whether you need to run to the doctor or wait a little bit, postpone the doctor's appointment, and make it a planned visit. Thank you so much for listening to me. I wish you all good health, and don't be frightened if you suddenly get tinnitus in your ears. Always there for you, Dr. PopMed.